So now we come to the stylomastoid foramen. What happens if there is a difficulty or there is a problem with the stylomastoid foramen? Maybe unilateral, that is on one side, or maybe bilateral, that is on both sides. The third, fourth, sixth nerves, as well as cauda tympani will not be involved. I repeat, third, fourth, sixth cauda tympani will not be involved, and so hyperacusis will be absent. That is when there is some noise or somebody talks, then you hear it very loudly. That is hyperacusis. That is absent because those cranial nerves are not involved. And even if, but there are some patients they are difficult patients and the diagnosis is difficult. So even if the stylomastoid foramen is not involved, you get the stylomastoid foramen fully investigated by an ENT doctor, and he says that the stylomastoid foramen is normal. Then the diagnosis changes. Then it is not the stylomastoid foramen. Either there is a trauma, that is the facial nerve has been cut and or during some surgery or during some injury. So either it is cut or there is a mixed parotid gland tumor. So again to repeat that if stylomastoid foramen is normal, then we have to focus on injury, operations, accident, trauma and mixed parotid gland tumor. And in this case, the only option, the treatment is that if it is not cut, you cut the seventh nerve because otherwise many complications will arise. And coming to parotid sarcoma, if parotid swelling is there and seventh nerve is paralyzed, I am again repeating, the parotid swelling is there and but the seventh nerve is paralyzed, then the diagnosis of the patient is either parotid sarcoma, or sarcoma, as you know, is also a type of tumor. So sarcoma or mixed parotid tumor. So thank you all very much. This was what I wanted to tell. This has been only one part of facial palsies, that is the upper motor neuron, which extends from the brain cortex to just before the nucleus of the spinal cord. And we will continue these classes. We will next come to the lower motor neuron lesions in the facial. Your questions are most welcome, and we will be answering them. And we will also, this topic has not been completed yet. Once this topic is completed, we have framed certain questions which will go to you with this chapter. And first you try to, don't straight away look at the answer sheet. First you try to, if you look at the answer sheet straight, then you are cheating only yourself. First try to solve it by yourself. If you cannot, then you ask us the reason or see the key. Ask us the reason, that is better, because that will we will solve your queries with the reason. So, and another thing is that regularly there will be some tests and some viva. Of viva means only in test form because we are in online, and some quiz tests, mock tests. They will be taking place in between, and maybe we keep some cash prizes for students who do well. So today we have started this online Dr. Shiv Shankar coaching classes, and soon the website and the other details will be available to you. And I urge you to we work together so that more and more the pre-PG result and your teaching is also good. And I have forgotten a very important point, that we are not only teaching the pre-PG students, we are teaching from first prof to final prof, and first prof to final prof, and subjects from first prof to final prof. We will give the coaching according to the university syllabus pattern. Whatever questions are asked in the university, you take. They will be included in your training, and you will tell that which subject is difficult for you, and we will train it. That will be according to the university exam, and side by side the PG training will go on. I think I have taken a lot of your time, and I thank you and wish you best of luck. Thank you.